We really appreciate you being here today. This evening is about you in this room. Our friends, our colleagues, our partners. ACHI is a small organization. Our mission is to be a catalyst. I'm a chemistry major. A catalyst doesn't make anything happen without the energy of lots of other folks. And you are that energy, and you have helped make things happen. This is our first time to fully get together in 3 years. I just want folks to think about it. Last time we were together, many of you were with us. We have some new faces. It was the fall of 2019. I was talking with my team. It's hard to believe that Omicron was just January of this year. Okay, just to think about it. Omicron was just 10 months away, 11 months away. So that's how much we kind of have compressed time and disrupted everybody's activity. But I want to thank you for your contributions, your strength, and your commitment throughout our state's response during this threat. That, just to pause for a moment, nobody else has been through a worldwide pandemic. You have now been through a worldwide pandemic. So when something stands up against you, you can say, wait a minute, I went through a worldwide pandemic. This is going to be nothing. I do want to have a special thanks and recognition for our sponsoring organizations, Arkansas Blue Cross and Blue Shield, Arkansas Children's Hospital, the Arkansas Department of Health, and UAMS offer us core support each year that's unrestricted, and that's the reason that we could be able to respond in the way that we did when this pandemic hit, to put some of the programs, some of the processes, some of the data elements in place. You know, for us, the last 3 years have resulted in new and strengthened partnerships. We've got a strong partnership with mayors across the state in the Arkansas Municipal League. I've had more meetings with school superintendents, teachers, and school nurses than I ever thought I would have. And all of those have not necessarily been the smoothest conversations because their school boards had different perceptions. The members of the state chamber, chiefs of police, fire departments, business leaders, community leaders. This has been a growing opportunity, a network that has developed, and we look forward to drawing upon that network to move us forward with you into the future health opportunities for our state. All those organizations, those individuals, I think, found value in our ability to take data, turn it into information to support decisions. That's basically my 15-second elevator spiel for anybody. We take data, turn it into information, hopefully support public and policy decision makers in their times of need. You know, our team has been resilient in this time of mis and disinformation. It has not been easy for us to hold the front line when some of the political and informational, waves hit us. But we were nationally recognized by the National Network of Public Health Institutes by their selection and receipt of their Impact Award during the epidemic. And I just have to give you a little bit of an example. It was just a year ago, a little over a year ago, if you'll recall. It's a year and a half ago when the legislature passed restrictions that did not allow school boards to pass mask requirements. Well, then in the flex of the summer experience last year, school boards were some were wanting to pass mask requirements, got caught up in the courts. We put a rapid cycle deployment effort in collaboration with the health department to monitor school mask policies each week over the course of fall last year. Some schools did nothing. Some schools required it. Some schools had a partial requirement. And to make a long story short, with our colleagues at the health department and the College of Public Health, along with their collaborators at the Center for Disease Control, we published the study that now's the standard that says if you put required masks in place at the peak of an epidemic, you reduced transmission by 25%. So that's now science and fact. Whether it gets used or not is up to us of whether we can take that information now to inform decision makers. But that was something that we really felt positive about. Looking forward, we're still dealing with the pandemic's impact. Mental health, stress, and impact, I think, has affected us all. It's affected our kids more and adolescents more than anything. National organizations last week called for a national emergency on children and adolescent mental health. Because of the stresses, we have more people that have turned to substances of abuse and have become addicted at a time that we have the influx of new illicit drugs, fentanyl and other drugs that make it more risky to have that condition. Our hospitals are challenged by financing issues that were present before, but exacerbated now because of some of the inflationary aspects that we all feel. And most importantly, the pandemic exposed disparities in access, disparities in outcome, depending upon your income, depending upon the color of your skin, depending upon your geographic location. And that exposure, we feel obligated with you to take to the ground and figure out how we resolve that moving forward. COVID's not gone, it's still a risk. And there are some new variants out there that I want to ask you to help us monitor. But more importantly, I want to ask you to get your bivalent vaccine. Only 10% of Americans are reported to have had this vaccine, and that is our best bet going forward with these new variants that continue to come out. Now, over the last year, it wasn't all COVID. Using the Healthcare Transparency Initiative under the authority of the Insurance Department, we impacted the national dialogue and documented what the benefit was for reducing colorectal cancer screening from 50 to 45 years of age. How many lives would be saved? We've done community needs assessment for for hospitals across the state. With our colleagues in the College of Medicine, we've got a National Institute for Drug and Alcohol Abuse grant to study the effects of medical marijuana, good or bad. We'll figure out what that impact has. The All-Payer Claims Database is supporting over a dozen researchers at UAMS and across the other campuses of the Biosciences Institute. We've launched an naloxone program to make the antidote Narcan available freely in emergency rooms, so that if a family comes with a family member that has an overdose, they can go home with the antidote, not have to wait and go to a pharmacy to be able to get that at some point in the future. We've got new partnerships with Northwest Arkansas Council's Healthcare Transformation Initiative, where we're helping them document the demand needs of the growing region of Northwest Arkansas. And of course, not to give Craig too much credit, but our Wonks at Work had its 33rd episode, and I would encourage all of you to listen to that, but avoid Craig unless you want to be on it or don't want to be on it. And finally, just let me thank you for the work you've done to bridge the divide in our community. We've got a lot of work to do, but we have survived this pandemic together. And I think much of the damage, many of the harms that the pandemic could have caused were avoided by the collected network that's represented here and by your network out across the state and in your communities. But let me turn tonight and recognize our Health Policy Board. If you're on our Health Policy Board, let me ask you to raise your hand if you would. These are 21 folks that lend us their time. They give us their advice. It is fairly candid. If we're thinking about something new, we get pretty rapid response of whether it was a good idea or a bad idea. Sometimes with the opportunity to improve it, but sometimes the opportunity to just flush it and keep on going. But let me ask Justice Tuck if you'll come up and join. Last year we honored Dr. David Williams, who served as the president and CEO of the Ozark Guidance Center with our award. Also want to recognize Marquita Little Newman. I don't think Marquita's here tonight, but she's a retiring member of our policy board, having served. She's the senior policy director at the Alliance for Early Success. The award that our board established is really the Arkansas Hall of Fame for individuals who have contributed to the public's health. Joe Bates is here as our inaugural member. We've had others over the course of the last few years. But Justice Tuck, let me turn it to you to actually share the Tom Bruce Award and announce our recipients this year. Thank you.
Thank you very much, Dr. Thompson. Thank you. And I am pleased to be here. I have been threatening Drew Campuris that he's going to have to take the podium eventually and become chair. But I want to tell you a little bit about the Dr. Tom Bruce Health Impact Award. Dr. Bruce dedicated his career to promoting access to quality health care for underserved and rural populations. He and his wife, Dolores, paved the way for ACHI's formation with a seed donation of $100,000. So he put his money where his mouth was. His generosity served to propel public health efforts to a new level in our state. As a tribute to his life and work, Dr. Tom Bruce Award, Health Impact Award, is given annually by the ACHI Health Policy Board. The honor is bestowed on an individual or group of individuals who has demonstrated courageous leadership and a sustained record as a catalyst for improving the health of all Arkansans and who exemplifies the core values of ACHI: trust, commitment, innovation, and initiative. Our first award recipient cannot be here with us today, but I know many of you knew her. I certainly did. Actually, I was just telling her niece, I knew all three powerhouse sisters. But before I talk about Dr. Lowe, I want to point out she has a powerhouse brother, John Lowe. Dr. Betty Lowe was an advocate for children's health in Arkansas, and few can match the legacy and the impact of Dr. Betty Lowe. She was born in Texas, raised in Arkansas, and she studied medicine at the University of Arkansas School of Medicine, now we know UAMS, where she completed a pediatric internship. After many years as a pediatrician in private practice in Texas and Arkansas, Dr. Lowe became the medical director for Arkansas Children's Hospital in 1977, a position she held until she retired. During her tenure at Children's, Dr. Lowe led its transformation from a facility with 2 patient wards and a few dozen beds to a nationally recognized state-of-the-art hospital with nearly 300 beds and 70 specialty clinics. She oversaw the hospital's first open heart surgery, its first bone marrow transplant, and first heart transplant. By the way, I got a tour and saw the babies, real tiny babies with heart transplants. It was amazing. She joined several prominent Arkansans in founding the Arkansas Advocates for Children and Families, another organization that provides trusted data to policymakers. In 1993, she was appointed by President Bill Clinton as an advisor to the Task Force on National Health Care Reform. She served as president of the American Academy of Pediatrics from 1993 to 1994, the first Arkansan and the first woman to serve in that role. She was passionate about children's health and a role model to medical students. That passion never waned, as evidenced through her web column, Ask Dr. Lowe, which she continued even in retirement. At her retirement celebration, President Clinton said of Dr. Lowe, "To me, she took care of kids better than anybody, and she inspired a whole new generation of doctors to do the same." She passed away in 2013. So this award obviously is posthumous. But now please direct your attention to the screen for a short video.
Betty was highly intelligent, down home, common sense, did not tolerate anything but a very high work ethic and standards.
The things that she was passionate about, she was no nonsense. She was passionate about children. She was passionate about Children's Hospital and her family.
She was fierce in her devotion to her patients, fierce in her defense of Children's Hospital and her promotion of pediatric health in Arkansas. And she was a force to be reckoned with. In fact, she and her 2 sisters were all forces to be reckoned with.
She was a caring person. She loved children. I don't know how many times when my children, her niece and nephews, would be ill and we'd go to see Dr. Betty, or Aunt Bet, as they called her. She would say to me, "Now, you don't need to be in this room. I'm going to talk to these kids." And that was kind of one of her mantras, that she wanted to develop a relationship with the children she was working with, no matter how young.
Betty really focused with all trainees and medical students and nursing students that being at the bedside, being with the patient is the greatest learning experience you can have.
She loved to educate anywhere, anytime, to anybody. She was a huge educator.
I think Betty's calling, I think she would call it a calling to be a physician, and then specifically a pediatrician, probably started with her upbringing in rural Arkansas, very family oriented, very education oriented, but very focused around children. The CEO of Children's recruited Betty because I think they saw a true leader. They recruited her with the help of Tom Bruce, who happened to be the dean at the time. They all became incredible friends, and that team of people, and then subsequently followed by Dr. Jonathan Bates as the CEO. That was the true big build of Arkansas Children's Hospital that took it from a few beds to several hundred beds, that took subspecialties in all areas, that took the access that kids could have for neonatal intensive care unit, cardiac surgery, cancer care.
She really did come to Children's and absolutely change, the face of Children's and the respectability and kind of put it on the map.
Betty's dream in advocacy was that that hospital in that system statewide, populated by pediatricians that she helped train, would help the kids of Arkansas.
Betty always thought that Arkansas always got a bad rap, and that really bothered her. And she thought Arkansas just as good as any other state. She just was such an advocate for children, but she wanted every child in Arkansas to have the same access, no matter where they lived, who their parents were. And she thought Arkansas Children's Hospital would be able to provide as good a care as any place on the planet. She got on all kinds of boards. She went to Washington. She did all these things that kind of got Children's Hospital and the state of Arkansas kind of out there for people to take notice of.
That was Betty's dream. She wanted no child to have to leave Arkansas to get the care they needed. She was on the Clinton Task Force for Healthcare Reform during his presidency. She was the president of the American Academy of Pediatrics, the only Arkansan and the second woman to lead the national group of pediatricians, the American Academy of Pediatrics. Her community service, she was one of the founders of Arkansas Advocates for Families and Children.
Betty was a true Renaissance woman. She just broke all the stereotypes. She could stand toe-to-toe with anybody in the country.
She loved children. She loved people. She loved dogs. She loved teaching and fishing, the outdoors, and taking her nieces and nephews fishing, that sort of thing with her. She loved Lake Washita, that's where she went to relax and get away from all of the trials and tribulations.
She never had kids, so all of her nieces and nephews were kind of her kids, and she was very proud of us, and she always wanted the best for us, but she also liked to try to guide us a little.
People need to understand how much receiving the Tom Bruce Award would have meant to Betty Lowe.
She and Tom Bruce were in medical school at the University of Arkansas at the same time.
She and Tom Bruce were great friends and great colleagues, and they did lots of things together. She was a legend in Texarkana, and she was a legend in Little Rock.
As President Clinton said when he was at her retirement party, her dream in life was to see that all the children of Arkansas had the opportunity to health care that would allow them to reach the dreams of their life later.
As a pediatrician in training, I benefited from the knowledge, the dedication, and commitment of Dr. Betty Lowe to the kids of Arkansas. I'm honored to bestow upon her, on behalf of our Arkansas Health Policy Board, the Dr. Tom Bruce Arkansas Health Impact Award.
Award for Dr. Betty is her niece, here to accept the 2022 Dr. Tom Bruce Arkansas Health Impact Award. For Dr. Betty Lowe of blessed memory is her niece, Gina Lowe Pfizer. Gina, in addition to this commemorative plaque, we also present your family with this one-of-a-kind decorative bowl from James Hayes Art Glass in Pine Bluff. Well, a little bit.
So I'm not a very good public speaker. I've been dreading this for months. But for Aunt Betty, I'm going to try to suck it up. So my family and I would like to thank the Board of Directors from ACHI for this absolutely fabulous honor to Aunt Betty. She's been gone now for 10 years. I miss her every day. So it's nice that people can still realize and appreciate everything she did for the state of Arkansas. I'm at Children's Hospital and people come in and I've got pictures of her in my office and they're like, so who is that on your wall? So it's nice that people still hold her memory and appreciate everything she did. So thank you very much. We all appreciate immensely that you've honored her and our family. So I would like to introduce my family that are able to be here. Her little brother, John Lowe, his wife, my mom, Delta Lowe, my husband, Bill Pfizer. He got married into it. Lucky you. My daughter, Alexis Calhoun, my son, Austin Calhoun, and his beautiful fiance, my future daughter-in-law. So anyway, thank you very, very much.
Thank you so much. And now we turn to a pilot. And you think, well, pilot, what's a pilot doing getting a health impact award? I got to tell you, there's a big reason, isn't there? Joe Swanson, raised in Ohio, hung model airplanes from his bedroom ceiling and dreamed one day of being a pilot. In 1970, his hard work as a student at the Ohio State University propelled him to become the first person on either side of his family to earn a college degree. The following year, Mr. Swanson joined the Air Force and entered pilot training, realizing that childhood dream. Later, he served as a T-38 and C-130 instructor pilot. Over his distinguished 28-year military career, he was commander of the 39th Tactical Airlift Squadron and the 94th Intelligence Wing at Fort Meade, Maryland, and commandant of the Combat Airlift Delivery School at Little Rock Air Force Base. In 1996, after a horrific aircraft accident at Jackson Hole, Wyoming, Mr. Swanson was assigned to lead the investigation. The result and lessons gleaned from that inquiry are still used in training schools today. He also served as a UN truce observer in Beirut, Lebanon, and as a staff officer at NATO headquarters in Holland. He retired in 1998 after ascending to the rank of colonel. And as many of us who retire, we don't retire. He embarked on a new career path as executive director of MEMS, where he took the EMS system to new heights. At MEMS, Mr. Swanson helped pilot an innovative in-house EMS training program, improving and expanding the state's capacity for producing EMTs and paramedics. I hear them a lot over my apartment building in downtown Little Rock. He led the project to design and deploy the statewide call center for the Arkansas trauma system. And his vision of a simple dashboard to keep track of hospital capabilities and capacity provided the framework for Arkansas's trauma communication system. Throughout his 23-year tenure as MIMS executive director, Mr. Swanson's emphasis on continuous improvement resulted in an EMS system that has saved the lives of countless Arkansans and is nationally recognized for its high standard of care. Now, I would like you to please direct your attention to the screen for a short video.
So I'm John Swanson, and it's my wife Kay, and she and I have been partners in a long journey that's included an Air Force career and the transition to MIMS after that. I did have a long career in the Air Force, and one that I really enjoyed. I was able to fulfill a childhood dream to fly airplanes, as well as some special assignments along the way that in many respects, both directly and indirectly, I think helped prepare the time at MIMS, because really it's all about a mission and the people who have to fulfill that mission. I was looking for something that had some real substance to it, that would make a difference potentially, and to be part of something much bigger than me. And so we found out about the opportunity at MIMS they had a vacancy for an EMS director. And I told Kay that, hey, this is what I think I want to do. And she laughed and said, you can't spell EMS. They're not going to talk to you. But they did.
When John started with MIMS, it was a good EMS system. However, John has taken it under his leadership from a good EMS system to a system that legitimately can be described as one of the top in the nation. He has built or helped build programs that have served Arkansans far more than anybody really truly understands that isn't in the industry.
He's very knowledgeable. He's curious. He's very ambitious. He's very busy. And his bridge game needs improvement. He needs a lot of practice.
I think one thing about John, you weren't going to outwork him. And when it came time to when he moved in as the executive director, one of the first things he did was go to school to be an EMT, to figure out really what the work was, what the job was.
He wanted to get the feel of the work that people were doing, and also appreciate and understand the nature of EMS in Central Arkansas, what people experience when they call an ambulance.
One of the early experiences that I had, and it made a huge impact on me, I was responding to a call to a young infant, maybe 6 weeks old. And I walked as a total stranger into this woman's world, into her home, and she hands me her 6-week-old baby, believing that the child is dying. And in fact, the child was. And looking in her eyes and realizing what it meant for her to be able to give that child over to a total stranger. Please help me. Please help my child. And I have never forgotten that experience. To tell it now is to give me some chills up my back, because of the impact of that and the appreciation of what that represented, to me, motivated everything about what followed was in the quality of the training, making sure the equipment and the protocols and all of the tools that the medics need is available to them.
He was the kind of leader that led by example while also showing you that he cared about the people that worked for him.
John could be tough and he could push you, which is the sign of a good leader, but he also very clearly supported you and was there to listen to you when you had ideas that you thought needed to be brought forward.
I've had the opportunity to work with John over the last 2 decades on a number of events, some predictable, some not. The first was in the Little Rock Airport hangar, where we triaged over 1,000 evacuees from Hurricane Rita and Katrina.
When he first hired me, he said to me that he would like to diversify the staff here at MIMS. He wanted MIMS to reflect the community that it serves. And that was important to me too, because it builds trust in the community when you see those that look like you show up in your emergency need. And he was very determined to make that happen, and it happened.
I think some of the major accomplishments that John had in his tenure there were our education program. In the past, we'd have to wait on people to go out and find an EMT school and spend their own dime and then go look for a job. By creating our own education program, we were able to hire people from the very beginning, pay them to go to school. And in fact, our program, the way it works is you're earning college credit at the same time.
When we began to develop the trauma system in the state, John saw a role for MIMS and approached the health department and was able to negotiate a relationship with the health department so that trauma communications flows through the MIMS dispatch center. So in reality, there are 2 dispatch centers in MIMS, one for regular emergency calls and non-emergency calls. And then there's a trauma communication center that's side by side. And they coordinate all the trauma activity to get the trauma patient to the right level of care as soon as possible. And they have dramatically reduced the time it takes to get a trauma patient into the right level trauma center. And they facilitate the admission, they facilitate the transfer, and have made a big difference.
And in the course of TraumaCom, the preventable traumatic death in Arkansas has dropped from 16% to 4%. And then when COVID came along, it was an easy, almost automatic transition. The governor referred to it as COVID-com.
Personally, for John, it's been a humbling experience and a great, great honor to work for the men and women of MIMS. For him professionally, it's the culmination of parallel careers in public service, first in the Air Force for 28 years, and then serving the men and women of MIMS for 23.
There's probably not a place in this state that you can go where his impact is not felt. His professionalism in building the brightest and the best that work in emergency services, he has touched a lot of lives.
No one at MIMS worked for me. I work for them. They're there to help people. And I am so proud to have been part of that organization of men and women who are so committed and dedicated to what they do. It's an amazing place and amazing people.
I worked for Tom Bruce in 1976 and 77 when he was dean at the College of Medicine. And John Swanson embodies all the strengths and the insight and intellect that Tom Bruce displayed.
John, congratulations. On behalf of our ACHI Health Policy Board, I'm honored to present to you the 2022 Dr. Tom Bruce Arkansas Health Impact Award.
Gonna need a medic. Is there a medic in the house?
John Swanson, it is with great pleasure that we present you with the 2022 Dr. Tom Bruce Health Impact Award. Congratulations. And in addition, of course, a beautiful James Hayes art glass, one of a kind, to give to you and your wife.
Thank you very much.
Thank you. And if you'd like to
Please.
make a statement.
Well,
we'll also listen to you.
Thank you, everybody, for this tremendous honor. And it is a very humbling experience to be on the stage sharing this honor with Dr. Lowe and your family. The experience at MIMS has been really beyond any expectation. Everything said in that video really kind of said, I don't need to do this. So, but there are a couple things that I do want to supplement or add. You know, Greg mentioned about going out on the truck and experiencing calls with paramedic partners. What he didn't tell you, though, was that every time I did that, I would come back and go straight to his office and say, tell me again why we do it that way, because there was a lot of reasons to
question and challenge and work to make sure that what we were doing was the best that we could for the medics, and the medics could do the best that they could for their patients. And that's always been what it's about. But there's one other program that deserves to be commented on, and that is the work that Clayton Goddard, who is one of the medics here, has done with what we called initially TCCC, Tactical Combat Casualty Care. And that's a program where, on his initiative, owing to his unique military background and experience, years before it became a national program, reached out to local law enforcement, local, state, and federal, and taught them how to use tourniquets, chest seals, protect airways, and literally do what soldiers do in battle to protect lives, save lives until medics can get to the scene. And he expanded that program into the Stop the Bleed program. He had a key role in doing that. And so that is now statewide with tourniquets in all the schools in Arkansas. That program in itself has saved countless lives too. And so I will tell you that in receiving this honor on behalf of MIMS, I said in the video, they didn't work for me, I worked for them. And so, you know, as I look back on that experience and really 75 years, I know that all of us would like to think that we've made a difference for having been here. And if I have, it's a small part of being part of this organization of men and women who do what they do with tremendous skill and dedication every day. I could not be more proud of being part of MIMS. Thank you very much.
Oh. Would you like your torn up speech? Okay. Well, I do want to say that Stop the Bleed is being taught now everywhere. In fact, my congregation has just learned Stop the Bleed for security reasons. And it is amazing. Thank you.
Justice Suck, thank you very much.
Thank you.
Thank you. I want to thank each of you for being here. We have one more thing and then we will let you continue your mingling. I want to ask Chris James, an award-winning poet, speaker, educator, and author, to join us. We discovered Chris for our knowledge and asked him to commemorate a poem last year that he had done before. We asked him to commemorate a new poem, a poem coming out of the pandemic experience that we have been through together. You know, this is an enormous network of folks. If you think about who you have worked with, who you have leaned on, who you have benefited from in the pandemic, we're coming through this now, and I'd ask him to come forward and share his important new contribution for us in the world. Chris, please join us. Thank you.
All right. We gonna figure it out. I needed a man with muscles. How y'all doing? That's what's up. Y'all look good. I'm gonna share with you all a spoken word poem. I hope you like it. If you don't, just act like you like it anyway. And you know, and snap. Everybody snap. All right. So check this out. Raise your hand if you've heard spoken word before. Anybody? All right. So for those who haven't, you know, I want to clear the myth that when you hear, and I know what kind of event this is, you know, you all are well dressed. You pulled out that outfit you've been waiting all year to wear, you know, but I don't want you to just sit there. I want you to engage. I want this to be fun. All right. So if you hear something you like, you snap or say, ooh, or say, wow. Or you can say, girl, did he say that? All that. I need all that big energy. So when I say how y'all doing, I want you to say the family is good. How y'all doing? That was like a C-. Let's get to an A+. How y'all doing? All right, cool. So before I get to the official poem, I want to start out with a song. Everybody clear your throats out. So I'm going to sing the song and you guys are going to repeat the song back to me. All right, so get your inner Beyoncé's and Justin Bieber's, whoever you want to be out. All right. You got a lot to smile for you. You got a lot to live for you. You got a lot to do, so you can't give up now. You got a lot to smile for you. You got a lot to live for you. You got a lot to do, so you can't give up now. See, y'all tried to trick me. And then I gave it to you by yourselves. Let's try it again. You got a lot to smile for you. You got a lot to live for you. You got a lot to do, so you can't give up now. You. Ah, that was good. That was good. Give it up for yourselves. All right, all right. That was really good. You know, y'all struggled a little bit, but we got through it. The same way we got through this pandemic and the way we still getting through it. You got through that song. All right. Amen. Hallelujah. So this poem that I penned specifically for this event is called The Second Mountain. And the young man who just got up here and shared, he said something very important. He said, they didn't work for me, I worked for them. And so what he spoke about is what this poem is about. It's about serving, you know, and I think that everybody in this room is doing that. You're serving. And you did something that I always wanted to do. You know, I always see it in the movies when they get up to do their speech and they tear it up. And then they, see, I'm going to do it one day too. So here's this poem again. Hope you like it. A poem for all the doctors, the nurses, the number crunchers, you know, the data collectors, the policy makers, the first responders, the servants of the people. I see you. Like, I really see you. They say that success is defined by how well you do for yourself, but greatness is defined by how well you do for others. You know, I see the calluses on your fingers and on your soul from all the work you've done. You know, all the seeds you've sown. You know, the amount of sweat and tears you shed are enough to fill the ocean. Between COVID, monkeypox, job turnover, and our collective mental health struggles, the last 3 years have been tough. You know, I can only imagine the amount of times you've considered giving up. You know, it's clear the work you do is a labor of love. You know, David Brooks, he's a writer for the New York Times. He speaks about people like you in his book, The Second Mountain. You know, there's two mountains in life. You know, on mountain one, it's all about what can I do to get me the most opportunity to afford me the most happiness and to fill my cup? How can I serve me? And then David speaks about somewhere on our journey, we eventually hit a valley, you know, a rock bottom, trying to figure out what more can I do to fill my cup. And this is when we discover mountain two. We realize that it is a more fulfilling life to serve something and someone beyond ourselves. I call this mindset shift the other side. Don't you recall the last time you poured into someone else? How it empowered you and gave you life. You know, it's an amazing feeling when darkness is before you but yet you have the ability to be light. You know, rather it's feeding a homeless man or donating to a football team so a child can continue to dream, or listening to someone cry it out, or letting a late mom cut you off in traffic, or turning your music down because you realize that your neighbor needs to rest a little bit more than you need to dance, or comforting a family that's grieving, or giving a stranger a hug because they simply need it, or like a lot of you, doing the job in spite of because you simply love the people. See, on Mountain 2, it's more than a job you're working. It's an intentional service. You know, you're dedicated to making someone else's life a little bit better on purpose. You know, it ain't no accident that you were designed to operate in this particular purpose. You know, everybody in this room is on purpose. You know, even in your moments of doubt, you are worthy. You know, it's because of you that this natural state is a blossom blooming. You know, together you are gardeners and farmers responsible for the great state of Arkansas even reaping a harvest. You know, to the office secretaries, to the emergency dispatchers, to the ambulance drivers, you know, to the lady who approved my health insurance that I never get to meet, to the public health practitioners, to the social workers, you know, to the project managers, to the researchers who collect the data to keep us informed of COVID rates in the state, to the governor who made the hard decisions, to the CNAs, to the hospital staff, that's the medical professionals, the cleaning crew, and the cafeteria workers too, to everyone who makes the great state of Arkansas a healthier place. If nobody has told you lately, thank you. Thank you.
Let's give it up for Chris. We've gone a little long and I apologize. This is 3 years worth in one night. I would like to invite you to enjoy the beverages and the food. We've got the Dave Williams trio that will be giving us some more music, but most importantly, this is a coming together where we appreciate each of you as part of our network, but each of you are part of everybody else's network. And I would encourage you to build those bridges. Let's make this network stronger and stronger. And I look forward, as our team does, to working with you in the year to come. Thank you all for being here.